study of anatomy and physiology is the study of structure and function. You can take anatomy by itself and physiology by itself. That's what I did. Here we teach it together because they kind of go hand in hand. So basically, anatomy is the ability of a student to identify structures. Keyword is identify. Very simply, what is it? What do you call this? Okay. There's different kinds of anatomy. There's microscopic anatomy. Microscopic anatomy is, well, the examination of things where you need a microscope. Okay, obviously it's called microscopic anatomy, but in this class, for example, just to give you an example, a cell can be viewed in some detail with a light microscope at about 400x magnification. In this book, chapter 3 is cell. Okay, to see tissues in some detail. You could go as low as 100x and see some, make out some fibers in detail. The study of tissues is called histology. Histo, tissues. Well, anyways, details can be seen at as low as 100x magnification. So, you know, microscopic anatomy, tissues, chapter 4, okay? So gross anatomy, that term means structures that can be seen with the unaided eye. Well, except for me, I need a little aid, my glasses. Gross. Gross anatomy. Structures that can be seen with the unaided eye. You know, there's different ways to teach anatomy. Talk about that, that's important. There is something called the regional approach to teaching anatomy. In the regional approach to teach anatomy, you teach the human body by region. Teach the human body by region. Now, the reason I mention that is the atlas that I highly recommend. An atlas is usually arranged in chapters by region. Just to give you an example, I'm going to look at the table of contents here. So the table of contents are back, thorax, abdomen, pelvis, perineum, upper limb, lower limb, head, neck, by region. And then when you study a region, you study everything in the region. The bones, the joints, the muscles, the nerves, the arteries, and anything else that will be in there. Okay? So you study it by region. The other approach is a systemic approach. The systemic approach is to teach anatomy by organ system. Okay? Now that's important for you is because the main area of text, this one, is the chapters are by organ system. So just don't look at that. So the first one is like the human body, chemistry, cells, tissue, integument, bones, skeleton, joints, muscle, muscular system, nervous system. Those are systems. So you study all the systems that function together for some purpose. That's what an organ system is. You're studying based on the organ system's function. So study based on structures. That all serve some common function. Let me give you one example of that. Of all some organs or all some function, the circulatory system, the cardiovascular system. Basically what you study there, you'll study this in 431, you study the heart, the heart is the muscular pump in your chest that pumps the blood. Everyone knows this. You study that. You study the blood vessels that carry the blood. In fact, you even have a chapter on blood itself, the liquid fluid that circulates. They all serve the same function, to circulate blood, and you study it all in one unit. Each of those, heart, blood vessels, blood, is its own chapter. But that's an example of the systemic approach. If you were to apply this to the regional approach, for at least for anatomy, you would study the heart in the thorax region. You would study the blood vessels in every region, because blood vessels are everywhere. And blood might be studied in another chapter, let's say in histology. Okay, but we do both, okay, because I'm asking you to use two books. This is regional, and this is systemic. So keep that in mind. For example, you got to study the humerus, the bone of the arm. Okay, humerus. How do I find humerus in here? I go to the chapter that's upper extremity. I got to study the humerus in this book. Where do I go? I go to the chapter that's skeletal system. So it's different. So keep that in mind in terms of regional and systemic. Okay. All right. All right, so physiology, what about that? Physiology is function. Physiology is the function of the organ systems, and it's hard to put in a nutshell, but one of the things we like to say off the bat is a major topic is homeostasis. As a student, you study how the body is able to maintain homeostatic balance. It's a big theme. Let me give you a definition of homeostasis. I'll say that's a focus of physiology. I'm going to define that more further today. It's a theme throughout your A&P journey, 430 and 431. To give you a definition of it, Homeostatic processes maintain internal conditions at appropriate and constant levels. Maintain internal conditions at appropriate and constant levels even if the external environment changes. So that's the definition. We'll go through examples later, okay? But just right off the bat, a lot of things we study how something gets out of whack. We call it homeostatic imbalance, and the body has a mechanism to self-correct. Now, we'll go through the steps later, but just to move on from this slide, just to put it together in terms of structure, function. Your author in chapter 1 has a figure of teeth. It's a simple example to show you how structure and function are important to know together in A and P. We'll study the structure of teeth and digestion later, but just to kind of, as an example of structure function, structure / function. Your incisors, your front teeth, they have a very sharp edge. They're like knives. So they're for cutting, not for chewing. They're for cutting and tearing your food. They're biting off a piece of carrot there. Well, the molars, bicuspid, tricuspid, it's called molars. Their cutting surfaces are more, they're raised and flattened. They're not sharp like your incisors. So they're more for chewing, okay? The word for chewing in anatomy is mastication. So basically, incisors, think of their sharp structure. The cutting and tearing is the function. For molars, their structure is more for the function of mastication. So, you'll see this theme come up all the time, okay? And structure and function, we do it together in anatomy and physiology, which is, I think, the best way to do it. Now, in terms of getting back to anatomy, there's a lot of terms of reference that we use so we can communicate to people when we're studying a cadaver, okay? So these are some relative terms that we commonly use in anatomy. Anatomy uses relative terminology. We need reference points to talk to each other. If I'm giving a presentation or if a student is giving a presentation, they have to use the right language. When you work in the medical field and you're in the surgical unit or something and people are talking, you have to use a precise language so it's understood. So when you talk, it's not, well, see this here goes there, and see that there goes here, and it's very vague and you can't follow. But if you use the right language, then you can communicate more clearly what you're talking about. First thing is look at this picture. Well, there's something called the anatomical position of a patient or cadaver, whatever you're studying. So this figure is showing it. The anatomical position is the human is, you're standing erect, right? Feet are slightly apart. Now the figure kind of shows them more or less together, but usually most books will say feet slightly apart. Notice the palms are facing forward, so the thumbs are out, palms facing forward. You're looking straight ahead. The gaze is forward. You're not looking down, you're not looking up. That's pretty much it. It's a relative position. So then whenever you talk to someone about anatomy, you assume anatomical position. Okay? Now, these terms written over the body are written over if the person is standing up. But a lot of times when you study a cadaver, the cadaver is lying on a gurney. If you're studying a cadaver lying on a gurney, the word supine means the cadaver is lying face up. Lying face up. If the cadaver is lying face down, that's called prone. The prone position is lying face down. But in this figure, you're standing erect. Okay. So, the first terms there, it's hard to see, I'll point to it right on the board, is superior, inferior. Superior is closer to the head, inferior closer to the feet. Superior to inferior. Again, these are the relative terms here. Superior, closer to the head. Inferior, closer to the feet. There's also cranial caudal. Cranial will be closer to the head. Caudal means closer to the tail, but that refers mostly to four-legged animals. We're on all fours, and we're not, so I don't use that. You also have anterior posterior, or ventral dorsal. Anterior or ventral means belly side, closer to the front. So anterior or ventral. Terms are interchangeable. It's basically closer to your front side. Posterior or dorsal. Dorsal means back, so it means closer to the back side. Okay, so looking here, medial lateral. Imagine a midline that divides the human body in half, left and right sides. Medial means closer to the midline, lateral means further out. Medial, closer to midline. Lateral, further away from midline. So we have a trunk with arms and legs attached to it. Okay, so if you're referring to extremities, something that's proximal is closer to the trunk attachment. Distal means further out in the extremity. Proximal, distal. Closer to trunk attachment. Distal further away from trunk attachment. Let's go through some examples. The hand is distal to the elbow, but the elbow is distal to the shoulder. Or, say the same thing differently, the shoulder is proximal to the elbow. Okay? The head is superior to the neck. The neck is superior to the breast region. Okay, and so on and so forth. The belly button is more anterior than the small of your back. Okay, and just keep going, and you get the idea. You have to use these terms when you describe things in anatomy. Any questions on the terms of relativity? It's pretty straightforward, I think. There's a blank figure you can study. Here's what I want to do. Something I do for points, actually. This will be your first points of the semester. I give out these little half sheets. I call them half sheets, but literally it's like a quarter sheet. Lab text, recycled paper, and I like to use it. And throughout the lecture, I'll stop talking for a second to give you a chance to breathe and to answer some questions. And I call them half sheet questions, like I want you to answer this now. So why don't you, I'll just leave them over here. Just everyone get one. I'll give you a minute. Anytime you see a pile out on any given day, grab one at the beginning of lecture. Today I'm putting it out right here. Everyone get one now. Take a minute. And when you get one, you get back to your seat, answer that question on the little half sheet, which you're going to turn in at the end of class for a couple of points. So these half sheet questions, it's really loose. It's not a quiz. You can talk to each other or just go solo, whatever you want to do. But put your name first, last. I'll give you something like 2 or 3 points for this. I haven't decided. And just answer that question. Shouldn't take you more than a couple seconds. Which is more proximal, X or Y? Well, what do you think? X is more proximal than Y. Okay, well, what about this one?
Y.
Yeah, why is more medial? And write that down. Okay, and we'll do harder questions. And I like to do this because it puts a break in the monotony of lecture, and also because I need to check for your understanding as we move along. There's no right or wrong here. I just look to see you answered all the questions. You'll get full credit. Okay. What I like to tell students is when we get a question that's a little more challenging than this, challenge yourself. Don't just wait for me to tell you the right answer. Like, commit yourself to an answer, write it down, and then when you see you got it wrong, you can't deny it, right? Because a lot of times we fool ourselves into thinking we understand the material. I tell you, you think the answer, and I tell you the right answer. Oh, yeah, I knew that. Yeah, I would have got that. That's why I want you to write it down, so there's no denying you didn't get it. Okay, sometimes I want you to realize that during the lecture. All right, let's move on. More terms of relativity. Keep that little half sheet available. We'll add to it, so write small. Superficial deep. When you're dissecting, I mean, you want to examine things that are deep underneath the skin. You have to dissect. I'll teach you the layers of skin later, but basically superficial. Means closer to the skin surface. And if we use the term, oh, it's deep, it means it's underneath it. Whatever it is, I don't know, but it's below, underneath. The dermis is deep to the epidermis. Epi means overlying. The subcutaneous tissue is deep to the dermis. Okay, so we kind of use those terms. Superficial, deep, moving on. Regional terms. Okay, so this is kind of where the terms, I'm not going to do all these terms right now, but this is what you signed up for. This is anatomy, knowing what parts of the body are called. So the regional terms are very useful for what's called, I didn't mention it before, surface anatomy. Okay, patient cadaver, whatever it is, that part of the body on the skin surface has a regional name, and that's kind of what we use to refer to certain body parts. I mean, you come in with a lot of this knowledge. I mean, my 7-year-old knows what arms and legs are. But in anatomy, we have more nuanced language. So for ones I think you should know from this figure, let's do it now. Start with cephalic. Cephalic means head in anatomy. Okay. Now there's some subregions there. If you look at this figure from the book, and since we're on figures, I kind of like try to use the figure 1.8, in the latest figure of the book. This book, it's the 11th edition. Okay? And if you'll notice, the bundle pack I have in the bookstore doesn't even have a physical book. It's ebook. Okay, that's the way things are going. And I'll tell you why I chose it. It was the cheapest bundle. That's the only reason why I chose it. It's to save you guys a little money. But if you're like old school like me, you like books, just get a book. If you want to save yourself some money, get an older edition, 10, 9, should be just fine. You save a lot of money, and you have a physical copy of the book. I'm fine with that. The thing is, I give figures for the latest edition. So if you have an older edition, it may not match, but it's not going to be hard to find if you find the right chapter. Okay, so moving on though, cephalic means head. Now that top word there, frontal, means forehead region. Orbital means the orbit that contains your eye. So think eye orbit. When you see orbital. You have nasal and oral. I think people know what those mean. Nasal is nose, oral is the mouth region. nasal nose, oral mouth, mental is chin. You know that Greek sculpture, the thinker, is like deep thought. And he's like, has this touching his chin. I think that's where the term came from. Okay. All right, moving on to head and then neck. Neck is the cervical region is the anatomy word for neck. Cervical. Moving on down to shoulder. You can say shoulder in anatomy, that's fine, but the fancy word is acromial. Right there, probably there. Acromial, that's where I'm at. I know the words are real small, that's why I always write on the board. Acromial means shoulder. Shoulder is a region. It's a joint too. Your shoulder joint. You can move your arm, right? We know this. All right, moving down to I'll do upper extremity. When we say upper extremity in anatomy, it's this whole thing. You might call it your arm, but we don't. Arm in anatomy means the region between shoulder and elbow. We call it the brachium. So the brachial region. The brachial region, or the brachium. Brachial region is arm in anatomy, the region between shoulder elbow. So that's a point of confusion in anatomy, because everyday language, arm means this whole thing. But in anatomy, arm is only this first part. Okay, well, then you get to the elbow. The elbow has a front and a back, an anterior and a posterior. The anterior aspect of the elbow is a little fossa or depression. It's called the antecubital region, where they draw blood. Antecubital, the front of your elbow. Front of elbow, basically. When you bend at the elbow, you have the bony elbow. The back of the elbow is the bony part, the posterior aspect. And that's the olecranon region. Olecranon region. Back of elbow. So antecubital, anterior, olecranon, posterior. So look at the posterior aspect of this man, and that's it right there. So then you get to the forearm. The forearm is the region between elbow and wrist. The word for forearm in anatomy is antebrachial. Go over here. Forearm, or the region between elbow and wrist. Don't confuse antebrachial with brachial. Those are different things. The word for wrist in anatomy is carpal. There are 8 little carpal bones that we'll learn later, but basically that region is wrist. The anatomy word for hand is manus. Let's see, where's the word? Yeah, manus is hand. And we'll study the bones of the hand in more detail there. For now, just know manus is hand. And for now, know that the anatomy word for thumb is pollex. P-O-L-L-E-X, thumb. Let's do some regions of the trunk. The orange thing colored there, that's the thoracic region, your chest. Chest region is basically, Mr. Ribcage, usually Mr. Skeleton over here. It's like, that's the thoracic region. Think of your bony rib cage, okay? Well, there's some sub-regions of the chest. They have sternum, okay? That's your breastplate. It's all listed as a indent for thorax. Sternum is the breastplate. Then they have, I believe, is it mammary? Yeah. Well, they first have axillary. The axillary region is basically the armpit. So to fully view the axillary region, you have to abduct the arm. You have to move the arm so you can see it. Because in the anatomical position, you pretty much can't really see it. You also have mammary region within the thorax. That's pretty much breasts. Because in females, there's the mammary glands, and that's why we're all mammals. We feed our young with milk through the mammary glands in the breast. All right, so you go from chest and down to the abdomen region. I'll put, it's basically where your stomach is. Usually in everyday language, people say it hurts in my stomach. They kind of touch their ab region. The stomach is in there, but the stomach is an organ for digestion in anatomy. That's why I put the quotes around it. That's basically what people are talking about. There's umbilicus, your belly button. And then you go down to the pelvic region. Now the pelvic region, like when you put your hands on your hips, that's your pelvis. Now pelvis is really a word you see a lot in anatomy. It pretty much means the widest part, okay? So here, in this part of the body, the pelvis is the widest part of your hips. Right, inferior to the pelvic region, they have inguinal region. Inguinal is groin, okay? Groin region. And they even point to posteriorly this perineal region right there. They point to there. It's the area between your thighs and your buttocks where your external genitalia are. Perineal. Area between thighs and buttocks. I said where your external genitalia is, that's one way to think of it. Another way to think of it, think of those little small bike seats, the shape of it. The shape of it fits the perineal region, basically. Okay, so that's the region. Small bike seat. Also back here, kind of in the region, the sacral region. The sacrum is the bottom part of the vertebral column, but let's list it here, this area between the gluteal region. So sacral is, the sacral region, I'll just kind of draw an inverted triangle, that's kind of the shape of it. There's that space between buttocks. Between the buttocks or gluteal region. Gluteal are your left and right buttocks, basically. So we're going from superior to inferior, and we're pretty much done with the trunk. Let me do some things back here. Posteriorly, on your back side, you refer to the whole back as dorsal. Okay, they have that term there. The back is dorsal. But your spine, right down the middle, is the vertebral region, because you have the vertebral column, your backbones. Yeah?
The dorsal, could you also refer to, let's say, an animal? The back is
Yeah.
the dorsal.
For an animal, yes. So it's the same as used. So vertebral, yeah, basically right down the middle where your spine is, that region. Your lower back is called lumbar. These two, think of it as the small of your back. Okay, the lumbar region. So lumbar region, small of your back. Some people just call it the lower back, the lumbar region. We'll learn about the full vertebral column later, but as a region, just know lumbar, lower back. Okay. And, I'll just turn Mr. Skeleton around. You got your shoulder blades there. The scapular region is important. Scapula, right there. Okay, that's the scapula bone, but we have a scapular region on the back side, there and there. So these surface landmarks are important, especially on the backside. If you have an obese subject you're studying and you can't see any surface features, you can palpate, you can touch and feel for this inferior angle right there through the skin. So as a, whatever you are, doctor, physician, pathologist, you can orient yourself and kind of know where things are. Okay, so that's why these regional things are important. Yeah, so I'm done with the back and all here. Let's continue down and talk about the lower extremity, or the lower limb. Well, they don't have hip, oh, they do, here it is, coxal hip. Let's put hip first. Coxal hip. That's when you put your hands on your hip, you know, kind of like that. Like I'm doing now. That's basically your hip. You also have a hip joint. It's like your shoulder joint. You can move your upper extremity, you can move your lower extremity. Okay, so you have a hip region, you have a hip joint. Now, your thigh is the femoral region, and it's the region between the hip joint and the knee joint. Femoral. Thigh. Region. Between hip and knee joints. So you get to the knee joint. Now the knee has a front and a back, has a posterior and an anterior. The front of the knee is the patellar region, where your kneecaps are. So I'll just put kneecaps. The back of your knee is a depression, and it's called the popliteal region, the back of the knee. Popliteal, sometimes it's called popliteal, popliteal region, back of knee. So the elbows and knees are kind of opposite. The front of your elbow is a little depression. That's antecubital. The back of your knee is a little depression, but it's called popliteal. For knees, the front of your knee is bony. That's the patella. For your elbow, the back of the elbow is bony, and that's the olecranon region. All right, so going more inferior, your leg is the crural region. So in anatomy, leg refers to the region between, excuse me, the region between knee and ankle. Now the leg has a backside, your calf. And the anatomy word for calf is sural. So don't confuse crural and sural. Your calves. Then you have your ankle. You get down to your ankle. Tarsal. Okay, it's your biggest ankle bone. Tarsal is for ankle. So for your foot, the word for foot is pedal. Okay? Pedal is foot. And there's a lot of terms listed under the foot. Well, basically, just know that the big toe is called hallux in anatomy. Digit 1 in the foot. Hallux is your big toe. In anatomy, you have hallux and you have pollux for big toe and thumb. Okay, we'll learn the rest later, but double checking, make sure I didn't forget anything. I think that's good. That's enough. Okay, but those are all the regional terms to get you through surface anatomy. This is where anatomy, the rubber hits the road. A lot of terms to know. Okay. Planes and sections, because in anatomy, we got to get skin deep. We have to study internal structures. So anatomists will make sections through a body. Or in your patient, there's a lot of imaging technology where you can see a certain plane in section. So you can cut it in different ways, or you can examine it in different ways. There's an MRI film, some kind of imaging on the figures below. If you're cutting a cadaver right in half or any half, that creates a right side and a left side. That's called a sagittal plane. Okay? So let's call this planes and sections. So sagittal So the sagittal plane is when you make the cut, you create right and left halves, right? Make right and left pieces. Depends where you cut. If you cut right down the middle, that's called mid-sagittal or median plane. Okay, it's self-explanatory. Mid means middle. But it's in that plane. You're creating right and left halves. Now, if you cut in the middle picture there, it's hard to see, but there's that cut right there. In a way where you get this image, or in a way where you cut, you make front and back pieces. That's called the frontal plane. Frontal plane. Sometimes the word coronal is used. So coronal or frontal plane. You basically make, if you do a cut, you make front and back pieces. If you cut in a way, like say cut in half here, you make top and bottom pieces, that's called a transverse plane. Sometimes we call this a cross section. Transverse plane. Transverse plane or cross section. What makes top and bottom pieces? Those are the three main ways you section a cadaver to study the internal structures, okay, or view them. Now, this comes from a different chapter, joints, but what I want you to know is you can move in these planes, okay? There are terms of movement I think you should know now. Because it's movement and joints help our body move. You'll find it in the joints chapter, but I think it goes along with this whole language of anatomy. How does the body basically move? How does an anatomist describe movement? Well, that's what this shows you. So some of the basic terms here, this top pictures is flexion extension. Flexion extension is movement in the sagittal plane. Okay, you're moving your limbs front and back. I call it the running man. Movement in the sagittal plane. I mean, just to give you a preview of how this is going to be important when you study muscle function. Let's see if I have it here. Let me switch to my iPad, and if you look to the left, there's a little icon there. It says 19. That's the app that came with the bundle if you bought it. When you open it up, If you download the free version on your iPad or device, you'll get the bones for free. And if you purchase, well, if it's in the bundle, you get all of the things. Okay, but if you don't buy the bundle and you just buy this separately, you download the free version and make an in-app purchase for the full version for all the systems. The bones are free. Let me just show you how you can do movements here. Muscles move the body joints. So if I want to say, gee, what flexes the shoulder? Let me turn on muscles. I'm just going to kind of hit the plus button here and build up all the muscles. I'm going to highlight a muscle. That's the anterior deltoid. I know that muscle flexes the shoulder. That's what I want to show you. So I just go to motion here. And, oh yeah, shoulder flexion. Isolate the muscle. It'll show you the movement. You can rotate it. I'll show you from the side. So that's showing you flexion. When the arm moves forward, that's flexion. When the arm moves back to the anatomical position, that's extension. So flexion, and then extension on the way back. Look at it from the front view. Notice the muscle lights up during flexion, because that's the motion I chose. There's extension. Look at the muscle light up. That's flexion. You can see what it looks like with the lights off. Gotta figure out these lights. So that's movement at the shoulder. Flexion, extension. Here's biceps. Let's show elbow flexion. So isolate it, show you from the side. There's flexion of the elbow. There's extension of the elbow. The muscle lights up when the joint moves. Okay, so that's flexion right there, and then extension at the elbow. So that's not so hard. Shoulder and elbow. Okay. What about hip and knee? Go back to full body. We'll learn all the muscles, but the movements, just know the movements, flexion, extension. Go to motion, and I'll choose hip flexion. So look at the joint that's moving, the hip. Notice that the muscle lights up during hip flexion. So hip flexion is when you move your hip up like that. When it moves up, it's flexion. When it moves back, what is it? Extension. So that's hip flexion, extension. Okay. What about knee? Let's look at knee flexion, extension. Here's knee flexion. The muscle lights up during knee flexion. So when you bend your knee, that's the lay term, right? If you close the joint angle in flexion, when you bend the knee like that, that's knee flexion when the muscle lights up. So when you bend your knee, flexion. When you extend the knee, that's extension, okay? When you're seated, like you are now, is your knee flexed or extended? It's flexed when you're seated. Okay, so that's that. I'll just tease you with the app a little bit, show you how useful it could be if you, when you start using it. And, take time if you get the app, if you're fortunate enough to have a device. I had a student one year, she got an iPad just so you could get this app, and she never took the time to figure out how to use it. It's an investment of your time to figure it out. This app could replace your anatomy book, okay, in terms of anatomy, not physiology. There's so much information, okay, and I can't teach everything, but since I was using it just right now, When you highlight a muscle, it gives you all kinds of information. When we get to muscles, you'll see how useful this is. All this information here. I showed you how it can move. It even tells you nerves and arteries. That'll be useful for 430 and 431. So I can just touch nerves here. And it can isolate the path, you know, the branch of the sciatic nerve. Okay, the yellow one is the nerve. You can highlight the innervation path, show you the whole body in purple. Okay, so it can really be a visual aid for you, depending on how you learn, which is, I don't know. But it's good stuff, basically. Okay. Next movement, turn the lights back on. Abduction, adduction. This is movement in the frontal plane or the coronal plane, right? Moving like snow angels. You make snow angels. You know, that kind of movement. Movement in coronal plane. Like, for example, AB, we say abduction because they sound the same when you say it. Abduction or adduction, abduction, adduction. Like a child abduction. Take the child away. So abduction is when you move the body part away from the midline. Adduction is when you bring it back. When you add numbers together, same thing, right? You add the numbers together and you bring the body parts together. You're adding them, I guess. Here's part of delt motion, shoulder abduction, abduction. Get from the front. Just move the arm straight out. Okay, that's abduction. When you move it back, that's adduction. Okay. You do the same thing at the hip joint. So that's that movement. I want to go back to the PowerPoint slides. A couple more movements that they show here. So they do abduction, adduction right here. Circumduction refers to shoulder and hip because they're ball and socket joints. When you can kind of move the limit away, where you're like making a circle. Okay, that's called circumduction. Move in a circular way. You just make a circle, circumduct. The other one is rotation. Rotation is important. For example, you can rotate the head left or right. You can rotate your neck. Rotation is not circumduction. Rotation is movement around a central axis. Movement around a central axis. So if you have, I don't know, some kind of structure like this, and you have a central axis going through it, and this thing can rotate around a central axis, you can rotate it one way or rotate it back the other way. That's what we're talking about. So for example, you can have medial or lateral rotation. Say for example, at the shoulder. Example, shoulder. medial lateral rotation. That's what we talk about a lot. I'm going to bend my elbow to illustrate. Here, anatomical position, bend my elbow. Okay, now I'm going to rotate at the shoulder. I'm going to go like this. I did that. Do you think I medially or laterally rotated? When you pull it toward the midline, think of it as medial. But if I rotate out like that, I go away from the midline, that's lateral rotation. Okay? Same thing at the hip. Yeah, anatomical position. Let's say I rotate right here, my foot is going to move out that way. So I move my foot out. Is that medial or lateral rotation when I move it out? It's more lateral rotation, but when I move it back to anatomical position, that's medial rotation at the hip. So in terms of movement, there's a correct way to name it. You name the movement, and then you name the joint or region that's moving. So let me write that down. So in terms of movement, name the movement. But then name the correct joint or region that's moving. Plus the correct joint region that's moving. So let's do some examples. Let's see here. Okay, on your little path sheet, just get it out and see if you can name that movement. I'm going to start like this, anatomical position. Just watch. I'm going to do it. That. What did I do? Just think about it. Write it down right now and see what you get. I'll do it one more time. What did you put for this? Flexion is correct, but what moved? The shoulder. Flexion at shoulder, or you could say arm. I moved the arm. So you could say flexion at shoulder or flexion at arm. That would be the correct way to name it. Okay. All right, let's do another one. Okay, keep going. So let's see. Go ahead and number. Are we on number 4? Mm-hmm. Okay, we're on number 4. Just keep numbering. Number 4. Okay, I'm going to start like this. But don't name this. I'm going to start like this and name the movement. I'm just going to go like this. That's it. Go ahead and name that for number 4. What'd you put? You should have put adduction at shoulder or adduct arm. Okay, write this down. So if you have the app, you can kind of practice that, but let's keep it to that in terms of movement. There's more, but I think that's enough for the first, well, for now anyways. And what I'd like to do is take a break, and we'll come back, take a 15-minute break, come back at 10:05, and we'll continue. And I give breaks, I ask everyone to leave, because so I can leave too. I can't leave you in here unattended. I know it's cold, so take what you need. I'll lock the door, and I'll see you at 10:05.